Senator has said, I apologize at least 4 times to me now since it's both and I assured him that we're a very forgiving community and we understand how these things happen. So no hard feelings on our part. Welcome to Genesis Health System and our beautiful Adler Health Education Center. Genesis Health System, for those of you who are visiting us, is a 501c3 not-for-profit organization. We do not endorse candidates, and we strive not to advantage or disadvantage any candidate or party. We have invited every presidential candidate competing in the Iowa caucuses to come and visit and share with us his or her vision for the future of healthcare in America, because we believe it's such an important issue for all voters to understand. Senator McCain graciously agreed to come, and we're so pleased to have him. Whether or not we are in the presence of the next president is, of course, a question time will tell. I think the ovation says that we all recognize we're in the presence of greatness, sir, and a true American hero. We welcome him here, and we're very eager to hear what you have to say. Thank you, Senator. Thank you very much.
Very much, Ken, and thank all of you for being here. And again, I am almost never late. I know that everybody's time is valuable, and I would hope you'll accept my sincere apologies for being late here this morning. It's both unattractive and inappropriate. So I will make my remarks relatively brief, because I think it's important that I hear from you and get your thoughts and ideas and recommendations. And there's a lot of issues that face America today, and there's a lot of issues on this campaign. But obviously, healthcare is the reason why we are here today. And I'd like to make a few remarks, remind you about what the gravity of the situation is, how it challenges that it presents to America. And I would also like to talk to you about how I think we need to address it. And then I'd be glad to respond to any questions or comments or insults that you might have. I would like to remind you as we begin our conversation that there's very little doubt in my mind, from doing already hundreds of town hall meetings, that healthcare is the overriding domestic challenge and issue of the 2008 campaign. In fact, it's also an area where I think there is a dramatic difference between the majority of the proposals made on the Democrat side and the view and the proposal that certainly what I have. And it really has to do with a fundamental difference, very frankly, and I say this respectfully, between Republicans and Democrats. I think that Democrats believe that government generally is a solution. I believe that the free enterprise system and less government and less regulation and less government interference makes for far more efficient delivery of services and goods, and best serves the nation by removing as much government intervention into our lives as possible. But first I'd like to remind you, and I've got some notes here that I just want to refer to very quickly, the gravity of the problem. We've got to reform health care and reduce the cost. If we don't act by 2015, the healthcare system will implode in a perfect storm. And it is a perfect storm. We currently spend $2.3 trillion, and I know you know a lot of this, but I think when we shape our discussion, I think we need to know these facts and the urgency of the problem in order for us to galvanize the American people to act. We spend $2.2 trillion. 16 cents out of every dollar we spend in America is on health care. By 2015, our expenditures will double to $4 trillion, and conditions will come together to destroy our system of care. My friends, straight talk. Medicare will be broke by 2019. Medicare will be broke by 2019. Currently, we are spending more on Medicare than we are on collecting in payroll taxes. We're cashing in the few IOUs left in the trust fund. In the meantime, more and more of our retirees' Social Security checks will also go to pay for Medicare. You know that in Social Security, they get a cost of living adjustment. That's got to do with inflation, right? And yet, if the cost of Medicare premiums go up more than the cost of living adjustment, you can figure it out. You can do the math. Every year now, because their Medicare payments are going up, then faster than their cost of living adjustment, what are we doing to retirees' real income? Social Security is on the same trajectory. By 2017, more money will be going out of Social Security than is coming in. Medicare will cost states more than any other responsibility they have, even more than education. Most of us will be without insurance, and those who are able to maintain coverage will pay much more in premiums and out-of-pocket costs. Employers will increasingly drop insurance coverage because it will simply be too costly. Insurance that is available will have higher premiums, greater deductibles and co-payments, and cover fewer treatments. Our companies will be unable to compete around the world. And I think, as you know, we just had a debate up in Detroit, Michigan the other day, which I won. And we, and this is why many foreign manufacturers don't come to the United States. Japan currently spends half of what the United States spends on health care, and they live longer. The same thing is true with the Europeans. The price of every General Motors car, you saw where General Motors went on strike briefly recently. The price of every General Motors car includes over $1,700 for health care costs before the first wrench is turned. More than the cost of the steel in the car. For Toyota, their primary competitors, it's $200. So you got a $1,500 differential before you first start to turn the first wrench. Well, we got to do something about it. And let me just say, in summary, my friends, the problem with health care in America is not the quality of it. There's ample testimony into this room and in this wonderful place of the quality of health care. It's wonderful. Why is it that whenever someone who's rich that lives overseas gets sick, they come to the United States of America for health care? They don't go to Canada. They don't go to England. They certainly don't go to some of these other countries where we have big government systems, where you sometimes, if you're an average citizen, you'll wait 6 months if you need an ordinary procedure. They come to the United States of America. So my whole point is that the health care, there's nothing wrong with the health care. It's the cost of it. And unless we get the cost of it down, it's going to be neither affordable nor available. And so instead of talking about how government should take things over, why don't we talk about reducing health care costs and making it affordable and available to every American? That's what we need to do. Affordability and availability. Let me just mention some of the ideas that I have, and then we will move on. We need to obviously eliminate the costly, low-value approaches that don't produce better health. Americans obviously should be in charge of their health care through health savings accounts and tax credits. American veterans should have a right, in my view, if they live hours and hours away from a VA facility. America's veterans, in my view, should be able to have a plastic card and come here if they have some health care needs. They shouldn't have to just go to a VA facility. Now, the VA has some very unique capabilities for treatment of PTSD, battle wounds, etc. And I'm all for that. And then we need to preserve the VA. I'm not talking about doing away with the VA. I'm talking about if a veteran lives up on the Navajo reservation in Window Rock and he has to drive 3 or 4 hours to Flagstaff to get treatment, why can't that veteran go to a local facility with a plastic card and get treatment? We owe our